Well, our next speaker is Ed Honeycutt, and Ed Honeycutt joined the Georgia Rural Health Innovation Center in 2023. He serves as a senior telehealth project manager. Bringing his past experience as regional telehealth project coordinator, Ed has managed multiple rural telehealth projects in Georgia, Tennessee, Alabama, and Florida since 2014. As a former teacher, he still enjoys teaching English as a second language to Chinese students in his spare time. Ed and his wife Ruth enjoy traveling, mountain biking, and spending time with children and grandchildren at their cabin in the Smokies.
Thank you. I forgot all that was in my bio, but now you know more about me than you really wanted to know. But so I think maybe, perhaps next to Dean Sumner, I probably have one of the best jobs at the medical school. I get to travel all over the state of Georgia, rural Georgia, all four corners, and I get to visit a lot of pediatric offices, and they're all the same, but they're all very different. You all have a lot of the same types of situations that you deal with on a daily basis, but like my friend Chris Scoggins used to say, you've seen one pediatric office, you've seen one. They're all different, and you guys, you're out there doing a tremendous job, and we really appreciate all the effort that you've shown and commitment toward our programs. So real briefly, Georgia Rural Health Innovation Center, we're involved with not only just the rural pediatric offices, we work with a lot of the rural ERs. We're in a lot of the school-based telehealth programs. We work in jails, and then we also have 7 of our own Mercer medicine clinics that we operate out of with telehealth. So we probably have on the number of about 60 some odd sites in the state of Georgia, and that's just continuing to grow. In 2023, I joined the Innovation Center, and I began working with the Children's Healthcare of Atlanta initiative, and we began rolling out telemedicine to the rural clinics in Georgia. And I think Dr. Lord here, she was one of our very first ones. I think Dr. Tarbutton, she was one of our first ones. Since then, that program has grown, and by the end of this year, we will probably have about 35 telemedicine stations throughout the state of Georgia just for the Children's Healthcare of Atlanta program. So, and then as this is a 10-year initiative, it looks like we'll probably, over the next 10 years, we'll have several more. So we're trying to blanket the state, and we're trying to get out there and make a big difference. So I kind of wanted to show you, let me see, talk about a little bit of an in-clinic, let's see, there we go, just a real quick.
In this video, we will highlight the fundamentals of a telehealth appointment, preparing the cart and exam instruments, engaging the patient and contacting the provider, performing a routine telehealth exam, and completing the exam and signing out. Prepare for the telehealth consultation by ensuring the telehealth cart and exam devices are properly attached and powered on. Begin by plugging the cable of the exam scope into an available USB port. Next, plug the stethoscope into the audio jack. If you know a heart and lung exam will be required, go ahead and open the auscultation platform in a separate window. You are now ready for the exam. Greet the patient and ensure they are comfortably seated on the exam table, facing the telemedicine cart. A parent or guardian should be in the room for pediatric patients. The clinic staff will have taken vitals prior to the telemedicine visit. This is now a good time to review this information with the parent before contacting the remote provider. Greet the provider, make introductions, and read off any vital statistics if requested. The provider may need up-to-date information for their records. Follow the instructions of the provider as you would in a live visit. First, examine the eyes with the general lens. Images will then be viewed clearly by the provider. From there, you will need to adjust the light and proceed to examine the throat. For ear exams, you can easily change the lens to the otoscope. Be sure to attach a clean speculum. If a heart and lung exam is required, you can now switch to the auscultation platform. The provider will be able to hear heart and lung sounds in real time. Once the physical portion of the exam is completed, the provider will ask if there are any follow-up questions, review the diagnoses, and prescribe any medications if necessary. Once the exam is concluded, the provider will end the call. This concludes this learning video. Thank you.
So outside of my rural pediatricians in the children's healthcare program, who uses telemedicine in their clinics right now? So how is telemedicine used in your
We
clinic?
have our children's medical services with
Uh-huh.
public health, so we use it for a sickle cell clinic and an orthopedic clinic. The
Oh.
doctors are based in Augusta and we're based in Dublin.
Okay,
So
and
we have the cameras.
the cart,
And we don't have that full card.
right?
I'm looking, I want one, but.
Well, come see me after the after the show. We'll hook you up. So how often
We use it twice a month.
Twice a month? Okay. Anybody else using telemedicine?
We have, we're with Community Health Service.
Uh-huh.
And we have them in all of our clinics.
Oh, wow.
So we can use them for, seeing the patient. If we don't have a provider in one building, we can set them up and see the provider in another building that way. I'm a nurse practitioner in Johnson County School, and so if the nurse is at another building and I can't be there, she can set up the child over there and at one school, and I can see him at another school. So we can use it that way as well.
Excellent, excellent. I think I saw a couple other hands. Anybody? Yes, ma'am. How are you guys using telemedicine?
School-based medicine, so in our school district, when we connect with local providers to see different, complaint types, urgent care type visits.
Which school system are you with?
Effingham County Schools.
Okay.
Savannah.
Oh, okay, right. And so is there like a telemedicine cart in each of the schools? This type of cart, right? Yes, ma'am. And so they call, now those are just, they're not scheduled visits, they're just,
They can be, our local pediatrician will do like med checks and stuff.
mhm.
But it's mostly, like I said, urgent care type, cough, congestion type stuff.
Right. So, yeah, so excellent, good. So I asked that question because I think if you had asked this question 5 years ago, crickets. You didn't really see telemedicine that much in the rural clinics. I think my prediction is that if you're not using telemedicine in the rural clinics, within the next 5 to 7 years, some form of telemedicine will be in your clinic. And because it's been growing exponentially. And I think in the state of Georgia, the Rural Innovation Center has been sort of the backbone of seeing that growth. And then, of course, our partnership with Children's Healthcare of Atlanta. So I wanted to ask, why do we want to use telehealth for rural pediatrics? Well, I think the number one reason is that it provides us access to subspecialty care in a rural community that you're not going to get anywhere else. If you go some of these smaller rural communities, and I know Dr. Davis will say we work pretty often with her clinic, and there's a nephrologist that sees some of her patients. There's not a nephrologist anywhere near Sylvester that's going to be able to offer the level of care that someone in children's health care can offer. So I think the primary reason is they just offer that access to subspecialty care in the rural community. I think the second reason is convenience. It's easy to set up a telemedicine unit. It's not always easy to get people to cooperate with getting the equipment in, but sometimes once you get the equipment in, it's pretty convenient. And then, of course, the convenience factor is primarily for the families. And I'm going to pick on Dr. Davis one more time. We did have a young patient there. They live about 5 miles from the Dr. Davis office. The young patient was an adolescent. She's about 12 or 13 now, but she's been seeing Dr. Davis since she was born. For her family to just imagine trying to pack up, go all the way up to Atlanta, deal with the Atlanta traffic, navigating Atlanta, find a hotel. Mom and dad have to take 1 or 2 days off of work, lose money, and then come back. All of that for a half an hour visit that could be done in an office with Dr. Davis. So it just doesn't make sense for the parents to have to do that with modern technology. So convenience for the parents and convenience for Dr. Davis and her staff as well. The other huge factor, and we've been charting this since 2023, is distance and time away from home saved. We're running several clinics now all throughout the state of Georgia, and the mileage saved is into the thousands of miles now. And that's for parents driving or pediatricians or having a rural a subspecialist drive to the rural clinics. So an enormous amount of time and money is being saved with having the rural clinics have telemedicine in them. So what are some of the barriers to telehealth? The original barriers usually, sometimes, believe it or not, we get a little bit of a pushback from some of the communities. So occasionally, we see that some of the rural pediatricians, or they will see that maybe some of the other doctors in their community might see bringing telemedicine as a bit of a threat. And we try to just overcome that by saying, well, we're not trying to take business away. We're trying to allow a service in here for the convenience for the parents to provide health care to children who would otherwise not ever be able to have it. So there's the physician reluctance, the community reluctance. There's also sometimes, there's a stigma, and I know my friend back there, Joan, will tell you, and often in the rural communities, there's a stigma, particularly with mental health. Joan works tirelessly with these communities, trying to get the parents and the communities to understand we're not trying to pinpoint a problem, we're not trying to highlight a problem, we're trying to help children. So there are some barriers to telehealth, but I think recognizing the barriers and learning how to work with the parents and the communities is probably the first step to it. So I won't deny that there are a lot of barriers to getting telehealth into your facility. One of the other barriers that we will see are patient reluctance. I know that sometimes you can have telemedicine in a clinic and the parents can be aware that it's there, but the parent might otherwise decide, well, I'm not familiar with that technology. I don't feel real comfortable doing this. I'm not sure, this seems very Star Wars-y, talking to a big screen and instruments and so forth. I think I'll bite the bullet and drive to Atlanta. So you do get some parental, you do get a little bit of pushback sometimes from the parents, But then, I think just having them say, if you can just get them to have one telemedicine follow-up visit. By and large, most of the experience of all the parents and the children that we have that go through our program see telemedicine very positively. So having some of those stories and some of those anecdotes and some allegorical information there to say, well, I understand what you're thinking, Mrs. Johnson, but we just had a patient who came through and they had a great experience with it. So patient reluctance is a barrier, but it is something that we can work through with guidance. And I also think having some patient-facing literature in the pediatrician's offices is very helpful. Where our team right now is working to get that set up. Digital literacy. I think that's a big one. It comes to a lot of our folks in the rural communities may not have the greatest, latest, fanciest, equipment, or I think the other thing that you'll often see is that they'll have slow bandwidth in their area, or they may have no bandwidth at all available in their home. Or even if they do, they may have trouble navigating a system to even make an appointment. I know probably all of you guys have something like MyChart or something that you use for your patients. And I know that, there are ways around it. So what we try to do to work with folks is to increase their knowledge on how to use these types of programs. We're working on a program right now where we're going to try to have some iPads in the offices so that the parents don't have to do everything on their phone that might not work. And then we have a whole backup team that they'll just pick up the telephone. And I know, Joan, you've had to do that. You just have to make phone calls and try to get folks in. And, we'll use old technology. We'll do whatever we have to do short of going out and knocking on doors. But, combating digital literacy is always a problem that you're going to face when you're working with telehealth in rural communities. But I think patience is the key, and understanding, how the patient feels. They're used to seeing a doctor. They're used to walking in and, Dr. Davis will take care of my problems. I've been seeing her for years. Why do I have to talk to somebody on a TV, right? So, this sort of relates to the same type of situation, same genre, is connectivity. You will see a lot in the rural communities. Connectivity can be a big issue. I think we've made great strides, but we're not there, blanketing the state of Georgia. Anybody who's driven anywhere 15 miles outside of a metropolitan area knows that you're going to lose a cell phone signal pretty quickly. So it's the same thing in the rural communities, having bandwidth. This is one of the reasons that we really strongly push the clinic-to-clinic types of interactions. There are telemedicine, a lot of telemedicine programs that are like pediatrician to home. They'll call the patient's home or they'll send a link. Those are often fraught with like fuzzy conversations or misinterpretations. And you also run up against possible HIPAA violations. You don't know who's listening in on that conversation. We try to mitigate that, and we try to mitigate the connectivity issue by having clinics, having the rural telemedicine setups in the clinics, because we go in, we set up and we do a telemedicine survey. We make sure that the clinics are set up and ready to run, and that they have the bandwidth. And if they don't have the initial bandwidth, we'll find the resources to get them bandwidth. So when the parent and the child come in to see, they're not having to deal with a fuzzy connection. So, but it's always an issue. Just going out and knowing that going in is very helpful, because you want to know what you're dealing with in any telemedicine situation, and being prepared to deal with it at the outset is always a good idea. So what are some of the platforms that we use in telemedicine? Well, there are multiple telehealth platforms. We have like some of our platforms are embedded in your electronic health record. I know like Athena. Who here uses Athena? Anybody? So Athena, there's a telehealth platform embedded in that. Epic telehealth platform embedded in the EHRs. And then there's a lot of standalone telehealth platforms, telehealth companies that will provide platforms. Some are really good for clinic-to-clinic use, and some are really good for clinician-to-home use. There's a brand out there, something like a Teladoc, where, back during the pandemic, people did not want to go to a doctor. You could call up with a sore throat, and you get Dr. Phil on your iPhone, and he prescribes amoxicillin. So there's that type of telemedicine too. But generally, in a clinic-to-clinic, you're going to want a good, solid platform that's going to allow for some note-taking and also for using some peripheral devices. Alongside and married to your secure video conferencing, you're going to see some auscultation platforms. Auscultation right off the bat is probably one of the primary uses, so we can hear some heart and lung sounds. Sometimes all you need to hear is just that you've got a good, clear heartbeat. There are some very extensive auscultation platforms that can do a deep dive and get different types of heart rhythms. We can actually have EKGs right now, and there are some very data-rich auscultation platforms out there. But for the general use, we'll just use kind of a simple platform that'll allow for some heart and lung sounds, and it'll allow for the pediatrician to hear a child breathing, and we'll use a stethoscope. So, and I think you saw on the video some of the devices that we use. Primarily, we'll have a telehealth cart, something similar to this in there. I don't know if this is fired on, but and then we'll use what we'll call a Horace exam scope. This is very popular, this scope here. There's several versions of exam scopes. This one's pretty easy to use. It's got like a little digital screen here. You can actually see what you're seeing. You can do a digital exam. You can look in the throat. You can look in the eyes. You can easily change and look and have an otoscope with this one. Look in the ears, look in the nose if you need to. We've got a derm lens here for dermatologists, so that whatever you're seeing, you can see pretty close up. The physician or the pediatric specialist can see close up on the other end what they're seeing. We also have, like I said, this is a digital stethoscope. There are several good digital stethoscopes out there. This one's a pretty simple one, but it gives a very good, clear sound reading. So those are some of the types of instruments that we're going to be using in telemedicine. And I think all of the rural pediatricians that are in the room right now who are involved in the children's program have these types of instruments in their clinics. So when is it appropriate to use telemedicine? Telemedicine is going to be in your clinic at some point and some time, but is it always appropriate? Not always. I think probably one of the biggest uses of telemedicine is going to be follow-up care. So if a child had an initial consultation with a nephrologist as a pediatric specialist, and then 3 months down the road, they just needed a med management, a quick follow-up, a 30-minute. That is perfect for telemedicine. They can go in, the kid can get the vitals taken, read them off to the subspecialist, ask mom and dad questions, see how they're doing on their medications, etc. Perfect example. Mental health consultations, absolutely. Probably the low-hanging fruit and probably one of the best uses of telemedicine out there. It's non-threatening. The child can sit. Usually a peds child is used to sitting in front of a screen anyway, so talking to somebody, 200 miles away is not a big stretch for them. So, mental health consultations are an excellent use of telemedicine. Emergencies? No. don't want to take a chance with telemedicine. I think that, we do have a number of telemedicine units in some of our ERs, but, those are going to be used for like consultations for a child who may have to remain on campus over a weekend to see if they want to transport them out or not. But if you have a very critical child, and you do not want to use telemedicine unless it's the last resort and you can actually absolutely not get any money out there. So it's not the greatest use for that type of medicine. And then, of course, when you have a comprehensive physical examination, maybe a child is going to be requiring an MRI or something like that. That's not, again, the best use of telemedicine. We're probably going to go ahead and recommend that child, maybe go to Atlanta or Augusta or wherever they're going and transport them up there. And then, what we do on our end is try to make sure that the resources to that parent are available, such as maybe travel funds or overnight stays. I know Children's Healthcare will bend over backwards to make sure that happens, to inconvenience them as little as possible. So, and then, the other thing when we're talking about rural telehealth, there's always the legal and ethical considerations. But in the state of Georgia, a telemedicine visit can be considered to be just as valid as an in-office visit, with a couple of caveats. The child does need to have a consent form signed by a parent or legal guardian to have a telemedicine. There is a specific form, telemedicine's consent form, in the state of Georgia. All of our school-based telehealth programs use it. All of our children's telehealth participants use it. So just to make sure that we're legal. Other than that, a telemedicine visit can be just as valid as an in-office visit. Prescriptions can be written, instructions can be given, follow-up and orders can be given, vitals can be taken and entered into the system, and diagnoses can be made via telemedicine. So, and then of course, you've got everybody in here. I don't even have to say the word HIPAA, but the privacy laws. And this is regarding telemedicine. So when we go in and set up a telemedicine situation or a telemedicine room, we want to make sure that room is secure and private. So it's generally in an exam room that would be as private as anywhere else in the pediatrician's office. And again, that's one of the reasons we really try to stay away from home-based telemedicine visits. Because you have no idea who's listening in on the background or what type of medical information is being spoken about and who's hearing it. So we try to contain all of those and try to keep that information as close as we can, as closely protected as possible. So there are some other considerations. It was pretty, when the pandemic hit, telemedicine actually just exploded, interstate telemedicine. So, a doctor in Florida, was allowed to take care of a child in Georgia, or, Michigan, operating in Tennessee. Those laws have tightened a little bit since some of those relaxations have tightened a little bit. But I think, going into it, just be aware that you can have interstate, but it just is a licensing requirement. Just want to make sure that pediatrician is licensed in that particular state to see that child. So it's a consideration. It's not a huge problem in the state of Georgia right now because we're not operating, none of the telemedicine units that we're operating out of the Innovation Center or through Children's Healthcare are seeing any pediatricians or any other providers out of state. But as we grow in telemedicine, it will be a consideration. So we just want to make sure that if you are contacting a pediatrician out of state, that a child may have just moved here and their cardiologist was in Miami and they still want to see their cardiologist. We just make sure we get all the proper licensure and then we can push the green go button on that. So best practices, you know, when you're in a telemedicine situation, you want to make sure that, first of all, you want to make sure that the cart is maintained and up and running. I usually ask that whoever is one of our telehealth champions or workers go in at least 30 minutes before, turn on the telemedicine machine, make sure it's got internet connectivity, we're connecting to all the sites, make sure all of the instruments are running and ready to go. I go ahead and have everybody set out the instruments, and then we also we want to have the parents come in maybe 15 or 20 minutes early, make sure that all the consent forms are signed, make sure that they understand why they're there, and that is a telemedicine visit and that they're okay with that. We've had parents come in and be very concerned about a telemedicine visit, so we'll walk them back into the room prior to the visit, show them the cart, you know, get them comfortable with the situation that's going on, because it's a little different than just having the pediatrician walk in. And then finally, you know, you want to make sure you have a good follow-up summary. Most of the, for instance, with the children's telehealth, children's pediatrics in Atlanta, they have their own EHR. They document in Epic, but you have your own emergency or electronic health record that you'll be documenting in. So we just want to make sure that all of that information is in there, any of the vital information and so forth. And then usually after post a telemedicine visit, you'll be communicating with the parent via a vehicle like MyChart or something else, so that you can follow up with the notes and they can follow up with the next visit or any clinical information that they needed. So, any questions, comments? It's exciting stuff. All right, well, thank you all. I appreciate everybody coming, and I will be out, I'm sure. I think we have some folks in here that'll be coming up. Dr. Williams and I are going to be meeting next week, and we're going to be talking about some of the upcoming pediatric offices that we'll be working with in the next year. So if you have any questions, any follow-up information, feel free to contact me or Harvey over here, or Dr. Williams, and we'll try to get your questions answered. Thank you so much.